We're here as part of the Human Dimension course, which is a required course for medical students at the Hackensack Meridian School of Medicine. A big part of our course is helping students understand as future physicians how to take care of all kinds of patients. Today's session was specifically focused on understanding patients with disabilities and this idea of ableism, that we need to create a world that is more open and friendly for all patients no matter what their abilities are.
The more you really talk and get to know somebody with any kind of disability, the more you add to that repertoire of kind of like knowing,
Field of physical medicine and rehabilitation, I guess I was lucky to stumble upon it as a patient back in 1990, but as a field of taking care of persons with a cross-section of disabilities.
We think it's critically important for students who are going to be future physicians to understand the humanistic side of medicine, so how we work with people. And really the most important takeaway is not to make assumptions.
Is there anything that you would like, takeaways, things you want them to know about your experience as a mom?
Yes. I think asking the right questions to your patients is very important, and trying to understand what their needs are.
I have one experience where I was getting my blood taken, and then all of a sudden they just came in. They have something I can squish on, and it helps the vein kind of, and that helped a lot. I didn't notice how much that helped, and when I went another place, they didn't give me anything, and they just I was like wait, and then all of a sudden they just put it in, and I was just and I had a bruise there for I don't know, maybe 2 weeks.
I would say what we've learned from our experience here at this medical school is that when you very intentionally create a curriculum that is centered on the social determinants of healthcare, what matters in our communities, we are creating physicians who will live and work in communities that have a big impact on people's health where they live.
I began the journey that I'm still on. It's the journey of disability and identity, of acknowledging and wrestling with related shame, and of working to advocate for myself to make the world work for me, rather than trying to fit into the world as if I do not have a disability, which is what I spent my whole life doing. Thank you.